Toss endless online searching to the curb. Let us edit out the noise and bring you medicine without misinformation. Welcome to the Med Edit podcast, hosted by me, Dr. Jessica Gray.
And me, Dr. Cari Sorrell. Together, we will provide real, evidence-based medical information that will empower your health decisions, answer your questions, even the cringeworthy ones, and help you navigate the overload of information related to health and wellness.
Let's sprinkle a little laughter and a whole lot of knowledge into your day.
Welcome. You are in the right place. This is the Med Edit podcast with your hosts, Doctors Jessica Gray and Cari Sorrell. I'm Patrice Sikora. This is the first episode of the show, and it's where we get to learn about Dr. Jessica and Dr. Cari, why they do what they do, and why they're doing this podcast. So, Jess and Cari, how are you?
We're doing great. We're excited to be here.
Doing well.
The first episode.
Absolutely. First of many, many, many. Now, Cari, let's start with you. How do you know Jess?
Well, Jess and I are both physicians in a fairly small community here in Texas. So we are colleagues. That's how we first met. So we share some patients in common. And then we got to know each other personally as well as socially, and our families as well. So now we're just good friends as well as colleagues. Both of our profession, of course, is taking care of patients. So that's where we first crossed paths. Jess is a family medicine physician, which means she pretty much takes care of anyone and everyone.
Definitely.
I'm always very in awe of the ability of the family medicine physician to take care of the wide range of ages and diseases that they do. So her job is comprehensive health care across all ages, genders, diseases, parts of the body. Whereas I'm a gastroenterologist, which is a lot more focused. And that basically means I take care of where food goes in to where food comes out, also known in fancy term as the digestive tract. Also some liver disease and some pancreas, which help break down that food, and some nutrition as well.
Yep, definitely. Cari has the very interesting job of talking about all the topics that most people would think are taboo or, just stay away from topics.
It's poop. Let's just say poop.
Absolutely.
Talk about poop a lot.
When I talk to some of my patients, and especially my teenagers or kids, and I have to ask them about things like that, their just faces of the total cringe that they have are absolutely fascinating. And I absolutely think what Cari does is just, it's fun too, right?
It is a lot of fun. I think the number one question I get from everybody is, what made you choose this for a living? No matter, if it's a patient or a family member, like, why did you choose this? What's wrong with you?
Why did you choose it? Why did you choose it?
Well, I always tease them as job security more than anything, right? You never run out of problems. When you talk to people, especially as they get older, one of the main things they always complain about is their bowels, right? I mean, there's always too much or too little. So I just felt like, I'd have an impact for years and decades to come without running out of patients to see.
Well, that's fantastic, Cari. I mean, wait till everybody has kids and they have pets. You talk about poop all the time. But face it, you do. But now, Jess, why did you go into family practice?
So, family medicine is one of the very interesting, unique positions in medicine where I have no idea what I'm going to see every day. Somebody can tell me what I'm going to see every day, but it inevitably is never just that. You go from room to room to room, and the next patient is completely different than the other one. And you get to really develop these relationships with patients over many, many years. And then relationships with you have one patient, then you see their mom, you see their dad, you see their grandfather, their grandchild, their child, their aunt, their niece, nephew. You have these entire families that you see for many years and, generations. And so the continuity of care in that specific field was definitely something that drew me to it. And then I love the idea of taking care of every age. I had an attending physician when I started in medical school, who she then was with me when I was in residency. And even when I finally she just recently retired, but she would always tell us that we take care of people from womb to tomb. So we literally from 0 to over 100. I mean, I've delivered so many babies. I don't deliver babies anymore, but I've delivered babies. I've taken care of them, in the womb and prenatal care. And then all the way been at, my patients' deathbeds. I've just recently sat with a patient at their house as he passed away, surrounded by a loving family. And so it's just a very interesting profession where I get to have all aspects of it in one and really develop a love and care for the entire family.
Right. Well, it sounds like you both really love what you do. Do you ever get frustrated?
all the time.
Never.
Which is so funny you say that, because that's exactly why we're doing this podcast. I mean, you can't even describe it more accurately than we get frustrated in our day jobs. We both have day jobs as, full-time physicians. We see patients day in and day out. And the frustration we've really developed over the last several years, it's been growing even more and more, is the lack of education, but also the misinformation that's, pretending to be education for patients is out there right now. Patients will go to the internet, which we've been doing this for 10 years. And the fact that we now have to fight more medical misinformation online and on social media these days, it's made our jobs a lot harder. It's been interesting because in this last 10 years, we're just seeing things change where patients used to come to your doctor and they used to say, okay, this is my problem. And then we, gave them advice. We gave them evidence-based information, meaning things that came from research and studies, and they trusted us. And now they come to us and sometimes they have a mistrust already coming into the office with us, and they're scared and they say, my friend told me this because some internet person told me this. And, you look at the internet person, they're not a doctor. They're not even close. They don't have a degree in anything they're saying, but they're really great with Instagram and social media. So they look really, really influential. And so we're combating medical misinformation on a daily basis now. And so how do you fight back? Well, we decided to start a podcast. We thought this might be an option that we can offer evidence-based medical information. We will hear that saying a million times over and over again, but it separates us from what else is on social media. Evidence-based means that we can back everything we say up with research, validated research, credible publications, things that are in actual journals and, consensus by committees of medical professionals that are experts in their fields. We're not making this stuff up. We're definitely going to be sharing stories of our own. We're humans, we're moms, we have kids and husbands and lives, but we want to share with you information that we use to treat our patients and how we make those decisions.
Cari?
And if we can't, we'll tell you where there's not information.
Yeah,
there are some things that we don't have that to back up, and we'll tell you that. So if somebody else tries to come at you saying, this is the answer, and we'll tell you that right now there is no answer. So at least you're well informed to know that that's also true.
Yeah, because that's the thing, is a lot of people are trying to sell you something. I mean, we can start off the bat right there. We are not selling anything. We are here. We're not going to sell you, hormone related products or vitamins or, anything else. We are here just to give information, to our listeners so that they can better their lives, hopefully their families' lives, and feel that they can create a trust in information they're receiving, and not, just because someone says that they have the magic cure. I mean, does that really usually ever work?
Yeah. So what are some of the topics you hope to cover?
Cari, you go for it. We've got a lot of ideas.
Yeah, we have a lot of ideas. That's the one good thing about medicine, is you never have a shortage. But we're hoping to cover things from symptoms of heart attack or heart disease, specifically in women who do present differently than men, all the way to, do I have lupus, to nutrition, skincare advice from a dermatologist. And there's going to be a wide breadth of information, and also kind of help prepare patients for when they do go see their doctor, so they have correct information. Like, how do I prepare for my first pap smear, or, getting a mammogram, getting a colonoscopy, which is, of course, my personal favorite topic, all those things. So also to make you as a patient feel more comfortable when you do go into these encounters with your own healthcare provider.
As physicians, we see, both of us see men, women, I see children of all ages and things too, but we do have a passion, especially for women's health. We are women, so we feel like we can give that unique perspective. We're women and mothers. So a lot of our information will be targeted mostly towards women. Some of the information we share that is applicable to men as well. So, something you can talk about, bring home to your husband, remind him to get his colonoscopy, or, something that will apply definitely to your kids. But like Cari said, we've got topics. I mean, we've got, one of the things we wanted to share is that we're going to bring some guests on the show as well. We sit here, we are experts in our field. We can say that we are experts in our field. That's why we have all our lovely advanced degrees and awards on the wall and stuff. We are experts in our field, but we also know experts in their individual fields as well. And we want to bring them on the show to share their experience, because this is where we continue our knowledge and this is where we get our information from as well. We have, great, amazing board certified any specialty you can pick. We've got psychiatrists, like Cari said, dermatology, plastic surgery. We got all the fun stuff covered too. We'll talk about anything from cosmetic things, infertility, OBGYN topics. One of the great ones we can even talk about with, cold and flu season, pediatric stuff, RSV, what to do when your kid is, breathing funny and not feeling great. How do you know when to go to the ER? Cari's experienced this. I've experienced this. Both our little ones, have had RSV multiple times in the past, year or so.
Absolutely.
So we want to share information from, credible guests, from us as well, that you can use in your daily life.
And we'll have this contact information in the show notes as well. But right now, I know you folks have a website. What's the website where people can reach you?
themededitpodcast.com would be where you can get us at our website. And
it's not that difficult to remember. No,
it's pretty easy. It's pretty straightforward. The Med Edit Podcast. Yes.
Mm-hmm. We are also on social media.
Oh yes. We are on all the social media. I mean, where else can you fight misinformation if you don't join it? So we're on social media as well.
Do you find the misinformation that people are getting from social media is taken to heart more by older people or younger people?
I can tell you it's both.
Yeah. I would say it used to be younger people was where we would see it, but now I agree. It's both. I mean, it's everybody from young people to older people who have really taken a lot of this information to heart and run with it. And, we're not blaming people by any means. When you don't feel good and you're looking for answers,
right? Yeah.
It's hard. You just want to feel better. You just want to figure out what's going on. I totally understand that. And so you go to where is the easiest access, right? Which is social media, the internet, to try to find a quick answer, to see if something works for you. So, I mean, I've been there. I've done that. I've tried to find a quick answer at times when I'm just desperate for information. And so we're hoping to have a platform that's easily accessible. So when people are in that situation, they have something to access without having to cut through all of the misinformation that is out there. But yeah, it's everybody now. I think everybody's engaged in some sort of social media platform based on their preference, and it's kind of pervasive on all of them now.
Yes, I have patients this week, literally this week in my clinic, that I was surprised. I have patients in their 70s and 80s that are quoting things that they heard, and it just depends on what topic they're talking about. Mm-hmm. That patient this week that was in their 70s was talking about vitamins and nutrition and related to that. And so, talking about, do I need my vitamin K added with my magnesium and all these things? And she was getting very upset and flustered and worried because she felt like she wasn't getting all the vitamins she needed. And as Cari talked about before, we're here to tell you what you don't need as well. And so I was able to tell her, okay, based on your medical history, based on these things, we don't need to be adding this. Or one yesterday was just saying how, well, I'm just going to keep adding more vitamin D. And they can't overdose on that. And I was like, yes, you can. Exactly. I was like, Cari knows this very well in her profession. I was like, you can overdose on vitamins A, D, E, and K. And, her face was shocked that she was like, wait, you can? I said, yes. I mean, we can cause liver damage, blindness, all sorts of things from over-the-counter vitamins. And these are the things that are being left out from your influencers who are just saying, oh, just go pick up any bottle you want. And more is always better.
More is not always better, as we're finding out. Yes. This is great, but I want to find out a little bit more about the two of you now, too. So when you're not working, what do you do for fun?
Well, I think Justin and I can both say our primary job is wrangling our children. So
absolutely,
which is fun, but also another full-time job. As far as for hobbies, when I do get the chance to try to participate in such a thing, I like to garden. So I
did not know that about you.
There you go. Yeah. I have a goal of trying to get my antique roses to grow in West Texas, which is a challenge. So I enjoy that quite a bit. I play tennis on occasion as well. Not very well, but I try, stay active, all those things. And then other than that, I love to cook. So that's actually probably what I spend most of my time doing. I actually do enjoy cooking for my family. And that's what I spend my free time when I'm not being a mom or being a doctor doing.
That sounds so much more entertaining than mine. I'm one of those people that I guess I feel like I need some hobbies. Like I would love to be the person that says I needlepoint or I crochet. I need one of those calm
Jess works out. She's really good about staying on a workout schedule. I have hobbies that try to keep me from having to work out because I don't like to.
That's fun. Yeah, I do a lot of working out, exercise, fitness stuff, which I think will incorporate that information about ourselves in the podcast, obviously. But I also volunteer a ton. I just apparently can't say no. So I volunteer a lot. I work for a lot of different nonprofits, including March of Dimes, a local nonprofit clinic in town that I'm president of the board for. I'm on something called the Laura W. Bush Institute, which is a women's health initiative. So I'm spread pretty thin. And then I do something super cool these days that just started. I am the Texas Tech University Lady Raiders basketball team physician, which has been a very fun. Yeah. And so we had, our first game that I went to recently. And so it's really exciting. There was nothing really for me to do until the last 35 seconds. And then I,
perfect.
got to go take care of one of my girls who was injured on the court. And so it's just one of those really kind of neat things I've fallen into the role of as well. So I'm taking my 2-year-old to basketball games now, which
perfect.
I have to bring my husband with me though, because I'm like, honey, what does that foul mean? Like, how many do they get? And then I was like, are there periods or quarters in this, or there are halves? Like, I'm like, how does this work?
Well, you've got a boy, Jess. You have to learn these things.
I do. Okay? I know. Carrie's the boy mom.
I'm a boy mom as well, so I also had to educate myself on multiple sports.
Oh yeah.
By the end of the season, you'll have it all down.
That's what I figured, right? I know. I was like landing in a position as a D1 NCAA like physician, team physician is definitely something that I could never have pictured in a million years for me. But it's definitely going to be fun. I figured after the first game, I already know a lot, so it's just got to keep going, right?
There you go.
All right. Well, then this brings up another question. What is your proudest achievement?
Oh, I think you could like have us both say that at the exact same time and be like a jinx or what? Yeah. People still do jinx anymore. We've just dated ourselves.
Yeah. I think if anything, we'll agree that we would say our family and our children, obviously number one. But I think we're also both very proud of professionally where we have achieved. I don't think you can have one without the other.
Definitely.
Being a doctor makes me be a better mom as well. Having that profession, I think, makes me better for my family, and being a mom and being a wife makes me a better doctor as well.
Absolutely.
So I think I would say both of them are very proud achievements for me.
Yeah, no, same thing. I am a better physician because I am a mom. Like I've been able to see that over the last, 10 years. Like my son's only 2.5, and I've been able to actually see the change in me being a physician with my patients. I think about things more, especially from a women's health perspective. I do see so many women, and I do handle a lot of mental health. I'm able to talk to them about postpartum anxiety and depression and things, and understand those stressors of having a child and doing that. We talk about things like breastfeeding. I mean, until you've been there, done that, I can only say so much. All of a sudden you're there and actually in that field talking about it. You're like, oh, let me tell you what I did. Or let me, I can give them all the facts and what the book says, but until you've been there and, done these things, and granted, thankfully we haven't been in all of our patients' shoes, with cancers and, all these other things we treat every day. But, one of the things I use quite often, my mom was just diagnosed with breast cancer. And so now having that experience of a family member, I'm able to really talk to my patients who I do diagnose with breast cancer, unfortunately, quite often. And I'm able to kind of coach them through those things and talk about it on a more personal level. Just being, having a family makes me a better doctor. I hope being a doctor makes me a better parent as well. I can handle some boo-boos at home.
There you go. We are good at crisis management, I would say.
Yes.
And also one of my sons has a chronic medical condition. So being a parent of a patient and being in that perspective has definitely made me a better doctor for sure. I think on, empathy and compassion in that regard, having been in those shoes is much different as a parent. And I feel like it's just made me much more understanding of my patients.
And as a female physician, do you find that you empathize more?
I was interviewed.
We'll see what the studies say.
Yeah. Oh my gosh, you're going to quote the same thing. I love you for that, Cari. So when Cari and I were both in, you're probably a fellow when that came out. And I was a resident still. There was a study that was published, and I think all female physicians like to reference this study these days. And I haven't looked it back up in a little while, but it was pretty well validated. And there were some studies showing that female physicians had better outcomes on multiple specialties, especially in the surgical specialties it was looking at, of their patients. We had better outcomes, and they were trying to figure out why that was. And apparently, per these studies, that female physicians tend to listen to their patients a little bit more. We have been shown to take a little bit more time with our patients. We speak, I guess they actually counted how many words were said by male physicians and female physicians. And how much the patient got to speak and interact and felt heard. And apparently female physicians scored a little bit higher. No disrespect to any of our male counterparts. Cari is married to a male physician who is fantastic. But it was something that, it was very nice to feel validated. The studies also have shown, different studies, that we spend more time answering messages, like patient messages and questions in the chart. We spend more time charting. There's a lot of extra things that go on that theoretically are due to us being female physicians and just having a little bit, our brains are different,
right.
than men.
Yes.
I mean, that's the statistical fact. We can't change that part.
Absolutely.
And nobody's going to argue with that. Not me, that's for sure. Now, who should, speaking about, women's health and being, female physicians, who should listen to this podcast?
We hope everybody, right? Especially, women, of course. We are targeting women of all ages, most specifically the ones that are using social media platforms to access information, which oftentimes, starts with usually college age women. High school sometimes look at these things, but not as much. We'd love to have some high schoolers ask us some great questions. I've got a niece who's in middle school who is just a genius child. She's amazing and she's interested in medicine. So I'm sure she'd have some great questions for us. You've got family members that have already given us some advice. So we want all the age groups. We want you to feel comfortable to ask us, whether you're in your, your college age, you're in your 30s, where we are, you're in your 40s. We're talking about, things like perimenopause and mammograms, or, we're talking about getting your colonoscopy, or then your 50s and 60s, like my mom, with breast cancer diagnoses, or, what prevention we should be doing there, heart disease, 70s, 80s. I mean, if you're, my patient, I've had patients in their 80s that are listening to podcasts, and they're telling me about, the podcasts and the murder mysteries, and I'm all about it.
I love a good murder mystery podcast.
For sure.
I can tell you that's one of my other hobbies.
That is one of your other hobbies. Yeah. If I had more time, I'd be so glued into more too. But I'm into those too, which is probably what joined us into this idea, is because we are interested in the fact that podcasts reach a wide variety of audiences, right? Of different ages.
And neither one of us could dance on TikTok. So we eliminated a few options. And we realized we didn't have dance moves. I cannot edit very well. So we thought this was probably the platform that best suited our personalities.
Yeah. Please don't make me dance in front of people.
Well, I am very glad you're here. I am looking forward to these episodes very, very much. So as we wrap this up, who wants to one more time give us the website where people can reach you and they can send in questions there?
Yes, they absolutely can send in questions. They can send in questions at the website, which was themededitpodcast.com. Or they can also send them on social media, reach out to us on Instagram and send us which
is also the Med Edit.
Yep. The Med Edit podcast as well. And on Instagram, we have Facebook. You can send us a message. Sure. Go on LinkedIn. We're there too. You can go on LinkedIn and send us a message. We're here for professionals. We're here for people that are both, educated in the medical field, and those that just have, this is brand new to them and they're just wanting to advance their healthcare.
All right. Jess, Cari, thank you so much. We'll be looking forward to your episodes coming up. And listeners, thanks for being with us. Of course, use that subscribe button. Don't miss any of the doctor's shows. Thank you for listening to the Med Edit podcast. Please click the follow button to be notified when new episodes become available. For more information about this episode and to learn how you can reach Dr. Cari Sorrell and Dr. Jessica Gray, please visit today's show notes. And don't forget, click that follow button to be notified when new episodes become available. The information and content has been made available for informational and educational purposes only and does not constitute a physician-patient relationship. If you need medical advice or help, contact your personal physician. The views and opinions of the guests do not necessarily represent the views or opinions of Dr. Jessica Gray and Dr. Cari Sorrell. This podcast should not be considered as an alternative for medical advice, diagnosis, or confirmation of an illness or disease. Please seek assistance from your personal health practitioner.